Hi and welcome to the part 2 of the Introduction to Health Promotion lecture. In this lecture I'm going to be talking about the what and why of health promotion. So health promotion is identified as a core macro practice strategy, highlighted here in Tracy's diagram, and today we'll be talking about the definition of health promotion and why we'd use these kind of approaches. So health promotion is the process of enabling people to increase control over and to improve their health, to realise a complete physical, mental and social well-being. So a state of physical, mental and social well-being. To realise their aspirations, to satisfy their needs and to change or cope with the change with the environment. Health is a resource for our everyday life, not the object of living. So it's something that we use every day to participate in occupations. Health is a positive concept, emphasising social and personal resources as well as our physical capacities. So this is the World Health Organization definition of health promotion that was released in 2013, and it's something that we use with our practice. So the development of this definition through the World Health Organization was built on the assumption that health is everybody's responsibility, and the resources for health extend beyond our traditional public and private health services. So health isn't just the responsibility of our healthcare system, it's the responsibility of all the different institutions, all the different physical components, all the different social and cultural factors within our environment. And that makes it everyone's responsibility, from the school teacher to the policeman. With the development of health promotion approaches, our focus has changed. So originally we focused on the patient as an object. Then we started to look at the patient-centered care and the person as the center of their treatment, which you should be familiar with. Now we talk about promoting health and wellness and keeping people out of hospitals to begin with. The old idea that prevention is better than cure, which means we're reducing costs of hospitals by keeping people out of that service system. And we're also providing prevention rather than treatments, which aims to help a larger component of the population and helps people earlier on in their symptomology, perhaps. So using a health promotion approach, we move away from individual blaming to consider the impact of non-biological individual determinants of health and the social and environmental determinants of health. So, for example, using a health promotion approach, if we see a person who is obese, we don't blame their obesity on their poor choices with their food. We think about the other factors that might influence their food choices and their obese health condition. So this might be because they have reduced access to healthy food. Maybe that where they live reduces their access to food. Maybe their income reduces their access to healthy food, or also their education and their knowledge about nutrition might impact on their health. So we look at the whole range of factors that influence a person's health and look at ways within the environment, within social factors and non-biological determinants that we can promote health for a person. So why do occupational therapists do health promotion? Why would we think it's important? A number of occupational therapy associations have released position statements that relate to health promotion. The first one here is by the Canadian Association of Occupational Therapists, which is a position statement on OTs in primary care from 2006. So in this position statement, they state that OTs in primary health care promote health and prevent injury with individuals, groups and communities by reducing barriers and encouraging participation in valued occupations or life activities. So in this statement, the role of the occupational therapist in health promotion and prevention is highlighted, and also the role of working with communities. In this second position statement, released by the New Zealand OT Association in 2009, the role of OTs in improving health through education, health promotion and counselling is highlighted, and also in maintaining health through participation in occupation to prevent the onset or progression of disease and disability. So here, first, we need to improve people's health. Second, we need to maintain health. And third, as a last resort, we restore health. But our primary focus is on health promotion and prevention. This last position statement was again released by the Canadian Association. And in this position statement on occupation and health, they highlight that occupational therapists have a role in contributing to health promotion policy through advocacy and research activities that identify obstacles for occupation and means to improve health. They identify that our clients may be communities, organisations or populations, and that we need to create policies, funding and legislation to integrate occupation-based enablement in government priorities to meet population needs. So not only in this position statement are they highlighting the role of health promotion, but also the role of macro strategies for health promotion and how important this is for occupational therapists to engage with. So why would an occupational therapist be concerned with health promotion? Well, health promotion is something that we do through changes to the environment, which is an important concept for occupational therapists. In this study, for example, in 2013, they reviewed healthy urban neighbourhoods and the impact on health status. And a healthy urban neighbourhood actually was significantly related with fewer people becoming obese. And the types of factors that were health promoting were close access to healthy food, so supermarkets and fresh foods, and also walkable neighbourhoods where people were less reliant on cars. So here we can see how the environment has a strong relationship with health status, and then as occupational therapists we have a role to play with changing environments to improve health and occupation. And I think Evelyn Doller highlighted this in her podcast on the MSP website really well, so make sure you have a look at that, have a listen to that podcast. So why would OTs have a role with health promotion? In occupation and improving occupational performance is a really important concept for occupational therapists. But why would we improve people's occupational performance if all we do is send them back to the same conditions that made them sick in the first place, or caused their injury or made them unwell? So as occupational therapists, if we are to improve people's occupational performance, we also need to improve the conditions in which people live to make sure that this is a sustainable and long-lasting intervention. Otherwise, we're just doing the same thing over and over again with no real outcome for the person or for the community as a whole or for the larger population. In this sense, we need to change the conditions that make people sick in the first place to have a larger influence. So that's the end of this part 2. The next lecture I will be talking about how we do this as occupational therapists. Thank you.